Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Glad that you could join us once again. Going to have a conversation with Dr. George Koob. He's the director of NIAAA at the National Institutes of Health, and he's joining us to talk about alcohol abuse and alcoholism and Dry January. Welcome to the program, Dr. Koob. Thanks for taking the time.
Thank you.
Now, as director of the NIAAA at the NIH, give us a brief background. How did you land there?
Well, I've been working in the addiction field for most of my career. Great deal of interest in the neurobiology of addiction and how drugs affect the brain. But I particularly spent a large part of my career working on alcohol, and so it was kind of a natural fit for me to come to Washington and help with our programs at NIAAA overall. NIAAA is the National Institute on Alcohol Abuse and Alcoholism, and we basically are the largest funder of alcohol research in the world. And we are, you could, it's our 50th anniversary, and you could well ask, well, what have we been doing over the last 50 years? And I think, one of the things that I would highlight is that we have really provided a great deal of evidence-based information about diagnosis, prevention, and treatment of alcohol use disorders.
How often do problems reveal themselves during the holidays? You may have a drinking problem, but no one really notices until the holidays. What are some of the signs that the holidays are heralding something a little bit more sinister?
Yeah, well, that's a really good question, and the way you put it, my answer is that it's because of impairments in social interaction during the holidays. And during the holidays is a time when you're meeting with friends and family and even coworkers, and alcohol can interfere with those interactions or cause some untoward effects. Like you may start wondering about that embarrassing moment perhaps at the party because you were a little over disinhibited, because of drinking. So I think that's one of the reasons why the holidays are also a period of high emotions. They can be emotions on the good side, but emotions on the sad side, because you often are, remembering people that are no longer with the family. And so these are, they're good times, but they're also tough times.
So you've got a friend, you've got a family member, everyone's reveling in the holidays. You notice something. You think you might want to say something. How do you approach them? And what are some of the things that you can do to help someone out, or at least get them on the path to some treatment?
That is a really tough question and a tough issue. How do you approach someone with an alcohol problem or a suspected alcohol problem without confrontation? And really, confrontation doesn't work. So there are a number of approaches, one of which is anonymous, is we have an NIAAA treatment navigator out there. You can go to that site and find out what an alcohol use disorder is, the spectrum of an alcohol use disorder, mild, moderate, severe, and what treatments are available for these different, if you will, stages of an alcohol use disorder. And finally, you can actually type in a zip code and on a locator and find treatment facilities in your area. So that's one approach. Another approach, I think that health professionals certainly could use is to, incorporate a little bit of motivational interviewing, which comes from psychotherapy, where you ask the person, how much money are you spending on alcohol, or how much time are you spending drinking? And, if you didn't drink, could you spend more time and maybe more money on your favorite hobby, or improving your car, or getting an upgrade to your car, or an upgrade even to your apartment or wherever you're living. I think that's another way to approach it. And another is if there really is a moderate to severe alcohol problem, use disorder kind of manifesting itself, you may want to get someone to engage their primary care doc in a physical. And usually an astute physician or clinician is going to pick up some issues even in a physical. And we encourage brief interventions in physical, so you just simply asking the patient how much they drink is a good way to get started.
Dry January, not taking a drink during the month of January. Is Dry January something that someone with an actual problem would even be willing to participate in, or is this something that can send a message to those who have a problem?
Yeah, I think Dry January is an interesting phenomenon, and I think it can benefit just about anybody who drinks. And, it basically allows you to evaluate your relationship with alcohol. And if you start to see all the things I mentioned that go wrong, go right, particularly in social interactions and the malaise that, is associated with not drinking, if you start seeing those reversing, your body is trying to tell you something. And I think that's an important aspect of it. One cautionary note, if you have a moderate to severe alcohol use disorder, abruptly stopping drinking could be dangerous, because alcohol withdrawal it can actually lead to death. And, in the old days, before there were medications and medical treatment for alcohol withdrawal, you would lose 1 out of 8 people due to hyperthermia and seizure or seizures. And so I think all of these things have to be taken into account. But for the average person who is questioning their relationship with alcohol, Dry January is a way of making that evaluation.
Okay, so a test, as it were. So if you're experiencing classic withdrawal symptoms within a week, then you should just stop Dry January and seek some medical attention or some other type of treatment. Yeah.
Absolutely. I mean, actually, some of those symptoms could come on in 24 to 48 hours. Wow. So, yeah, I mean, if you're a really heavy drinker, you don't want to Dry January on your own.
Now, I understand that NIAAA is celebrating 50 years.
You could well ask, well, what have we done over the last 50 years? We have, I think our biggest contribution is to provide evidence-based information on diagnosis, prevention, and treatment of alcohol use disorders. The good news is there's been a steady decline in underage drinking over the last 10 years. There's been a decline in deaths on the highway due to drinking over the last 30 years. We still have some challenges, binge drinking, high-intensity drinking, deaths associated with alcohol overdoses. But, I think that we've learned an enormous amount about how alcohol affects the brain, how alcohol affects the liver, and we're hoping that will translate into, better treatments, both behavioral and medical for alcohol use disorders.
With this explosion, a literal explosion of treatment centers, treatment companies, commercials, how does someone vet a good treatment center or treatment program with all of the programs that have come up during the past decade?
Yeah, that's another really good question. And I would recommend that they visit the NIAAA Treatment Navigator and see what comes up in their area using the locator. And in the Navigator, we outline exactly what you should be looking for in a treatment program. And I think that's excellent. The other thing, just very quickly, rethinking drinking. If your individuals use their search engine and look up rethinking drinking, you'll get a lot of the information we've been talking about and a lot of the links to the other pieces that we've been talking about.
Now, you're the co-author of the Neurobiology of Addiction. Where can our listeners go and get some more information about the topic that we've been discussing this morning?
Well, the Neurobiology of Addiction is a tome, but there is a better, a more readable book that I put together a couple of years afterward that is a textbook for undergraduates, and so that's one place to go. But the NIAAA website, which is niaaa.nih.gov, is another place you can go for links to some of these kind of documents. The Neurobiology of Addiction is 10 years old, and it's a great resource for researchers. We are revising it, and that's underway. Okay. But there's the volume 1's already out. And volume 2, we got the proofs yesterday.
Looking forward to speaking with you again in the future. It's been a great conversation this morning. Thank you for taking the time, Dr. Koob.
You're most welcome, and Happy New Year to everybody.
Happy New Year to you as well. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this conversation are available at hpr.fm, healthprofessionalradio.com.au, and you can also subscribe to our podcast on iTunes. Listen in, download at SoundCloud, and subscribe to our YouTube channel at youtube.com/Health Professional Radio.